We all know about the common cold and the flu. These are illnesses that have been part of our lives for as long as we can remember. They come around every year, especially during the colder months, and affect millions of people worldwide. These illnesses spread quickly, especially during certain times of the year. Crowded places like public transportation, schools, and workplaces become hotspots for transmission. People often wear masks and take other precautions to protect themselves and others. But have you ever heard of HMPV? It's not as well known as the common cold or the flu, but it's becoming increasingly important to be aware of it. HMPV stands for Human Metapneumovirus. This virus was first discovered in 2001, and since then, it has been identified as a significant cause of respiratory infections. It's a respiratory virus that's been around for a while, but many people still don't know much about it. HMPV can affect people of all ages, but it is particularly concerning for young children, the elderly, and those with weakened immune systems. HMPV is becoming more common, and it's important to understand what it is and how to protect ourselves. Just like with other respiratory viruses, practicing good hygiene and taking preventive measures can make a big difference. Just like the flu, HMPV can cause a range of symptoms, from mild to severe. These can include coughing, sneezing, fever, and fatigue. In some cases, it can lead to more serious conditions like bronchitis or pneumonia. In this video, we'll delve into the details of HMPV, exploring its nature, transmission, symptoms, prevention, and treatment. Understanding how this virus spreads and what we can do to prevent it is crucial for our health. By understanding HMPV, we can all take steps to safeguard our health and the well-being of those around us. This includes staying informed, practicing good hygiene, and supporting each other in times of illness. Knowledge is power, and when it comes to our health, being informed is the first step toward prevention and well-being. By educating ourselves about HMPV, we can make better decisions for our health and the health of our communities. Let's begin our journey to understand this increasingly prevalent virus. Together, we can learn how to protect ourselves and those we care about from HMPV and other respiratory illnesses. HMPV, or Human Metapneumovirus, is a respiratory virus that infects the lungs and airways. It is part of a larger group of viruses that can cause respiratory infections in humans. It was first discovered in 2001 in the Netherlands. This discovery was significant because it added a new member to the family of viruses known to affect human respiratory health. Researchers found it while investigating a group of children with respiratory illnesses that couldn't be explained by other common viruses. These children were suffering from severe respiratory symptoms, and the usual suspects like influenza and RSV had been ruled out. HMPV belongs to the Pneumoviridae family, which also includes the respiratory syncytial virus, or RSV. This family of viruses is known for causing respiratory infections, particularly in vulnerable populations. RSV is another common respiratory virus that causes cold-like symptoms, particularly in young children. It is one of the leading causes of respiratory infections in infants and young children worldwide. While HMPV and RSV share some similarities, they are distinct viruses. Both can cause severe respiratory illnesses, but they have different genetic makeups and can affect people in slightly different ways. HMPV is a relatively new virus, and scientists are still learning about its long-term effects and how it behaves. Ongoing research is crucial to understand how this virus spreads, how it affects different age groups, and how it can be effectively treated or prevented. However, we do know that it can cause a range of respiratory illnesses, especially in young children, older adults, and individuals with weakened immune systems. These groups are more susceptible to severe symptoms, which can sometimes lead to hospitalization. The immune response to HMPV can vary, and researchers are investigating potential vaccines and treatments. Understanding the immune response is key to developing effective medical interventions. Public health measures are also important in controlling the spread of HMPV. Awareness campaigns and preventive measures, such as wearing masks and practicing good hygiene, can help reduce transmission. By staying informed and taking appropriate precautions, we can protect ourselves and our loved ones from HMPV and other respiratory viruses. HMPV spreads easily from person to person, primarily through respiratory droplets released when an infected person coughs or sneezes. These tiny droplets can travel up to 6 feet and infect others if they land on their nose, mouth, or eyes. You can also contract HMPV by touching a surface contaminated with the virus and then touching your face. This is why it's crucial to practice good hand hygiene, especially during cold and flu season. HMPV is most commonly spread during the winter and spring months. similar to other respiratory viruses. The virus can survive on surfaces for several hours, making it easier to spread through contact. Understanding how HMPV spreads is essential to implementing effective prevention measures. Recognizing the signs. Symptoms of HMPV. The symptoms of HMPV are similar to those of other respiratory infections, such as the common cold and the flu. This can make it challenging to identify the virus based solely on symptoms. In fact, many people who contract HMPV may mistake it for a mild cold. This is because the initial symptoms are often quite mild and can be easily overlooked. Common symptoms of HMPV include a runny nose, which is often one of the first signs of the infection. Other symptoms to watch for are a persistent cough, a sore throat that can make swallowing painful, fever, headache, and body aches. These symptoms can vary in intensity from person to person. In more severe cases, HMPV can lead to bronchitis, pneumonia, difficulty breathing, and wheezing. These complications are more likely to occur in individuals with pre-existing health conditions. Symptoms usually appear within 2 to 5 days after exposure to the virus. This incubation period can vary slightly depending on the individual's immune system. While most people recover from HMPV within a week or two, it's important to rest and stay hydrated during this time to help your body fight off the infection. Some individuals, particularly young children, older adults, and those with underlying health conditions, may experience more prolonged symptoms. Those with weakened immune systems are at a higher risk of developing severe complications from HMPV. This includes individuals undergoing treatments that suppress the immune system, such as chemotherapy. They may require hospitalization and more intensive medical care to manage their symptoms and prevent further complications. If you or someone you know experiences any severe symptoms, such as difficulty breathing, persistent chest pain, or confusion, it's important to seek medical attention promptly. Early intervention can be crucial in preventing the progression of the illness and ensuring a better outcome. Vulnerable populations. Who's at higher risk? While anyone can get HMPV, certain groups of people are more vulnerable to severe complications from the virus. These include infants and young children, as their immune systems are still developing, making them more susceptible to infections. Older adults are also at higher risk because, as we age, our immune systems naturally weaken, increasing the risk of severe illness. People with weakened immune systems, such as individuals with HIV/AIDS, cancer patients undergoing chemotherapy, and people taking immunosuppressant drugs, are particularly vulnerable. Additionally, people with chronic lung diseases like asthma, COPD, or cystic fibrosis are at a higher risk of complications from respiratory infections. It's crucial for these individuals to take extra precautions to prevent HMPV infection. If you found this video useful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more great content like this.